I would like to introduce to you Alex Schneider. He is a Russian German and holds a PhD in chemistry. He is currently working as an account manager for ViiV Healthcare. Alex Schneider, could you introduce yourself a little more to us and tell us how you became a volunteer helper to migrants with hepatitis B and C?
Hi, everybody. Yes, thank you very much for the kind introduction. As you already told, that I'm Russian German, so I was born in Soviet Union and grew up in the Ukraine. So and later got my PhD in biochemistry in Germany. So and since more than 20 years, I work in different scientific fields, and more than 15 years in HIV, hepatitis, and tuberculosis. And then I become HIV myself. And I decided to give my efforts to community, and of course HIV and hepatitis and tuberculosis, especially in East Europe and Central Asia, it's all infection which go together. So this is why I started to help not people only with HIV, of course, with hepatitis, C and B, and tuberculosis. So and since 1 year, as you mentioned, I work at ViiV Healthcare, but today I'm here as an activist, as a private person, and would like to give you more information about what we are doing.
Exactly. So tell us, what does it mean you are an activist or you are accompanying migrants? What does this mean in everyday life? What are you doing?
I just help people, support people.
Means what? What are you doing there?
I mean, they call me and ask all questions, not only about hepatitis. They ask also where they can, I don't know, buy the food or something like this. I mean, because, you know, people, especially refugees, come here and they don't know our healthcare system. They don't know our legal system, nothing. So, and they need the help. Of course, they've got the help from migration center, but many things they cannot disclose to them. For example, their hepatitis status. This is why they call to me and trust me and explain and ask many questions. Yeah.
Right. We will talk a little later about the stigma and all these problems. As I heard, you are taking care of a lot of migrants from Ukraine, since we have a lot of Ukrainian refugees or migrants in Switzerland. Tell us a little bit what are different there, or what's special? What kind of special needs do they have?
I mean, first of all, they come here with a family, like, for example, with a mother-in-law and other with the children. And the migrant authorities, they always ask if they have any health issues, and no one can disclose this what they have, because as I mentioned about stigma and discrimination, and they just need later they recognize it. They need the help. They need support with medication, with the treatment, and all of these things. Then they call their doctors in the Ukraine, and they know me already because I helped people before during the COVID-19. You know that many people stuck here in the Europe, and I helped like more than 1,000 people across whole Europe. So and they call me and they say, okay, Alex, can you here support people who is now in Switzerland, for example?
Maybe tell us a little more in details. You mentioned that they don't dare to say that they have maybe hepatitis or HIV because whatever is their families around. Can you explain this a little more culturally? What's happening, or what's the problem?
I mean, the problem, stigma inside of the community, inside of the society, in many cases in the Ukraine, or we are talking about whole East Bloc, like it's not only Ukraine, it's East Europe and Central Asia. You have a special clinics for people who has HIV, hepatitis, and tuberculosis. And if you go to the special clinic, everyone knows that, oh, you have a hepatitis. And if you have a hepatitis, it's immediately for the people. For example, if it's B, okay, you've got like because of sex with, I don't know, somewhere. And in that case, you are like a bitch, sorry. So, and or for example, if it's hepatitis C, it's many cases, okay, you are drug junkies. So, and all of this inside of heads of people. And this is why they don't want to go. And they think that we have the similar system here in the Switzerland, and then explain, no, it's no one will charge you, and you just come. Not also the doctor will not ask you such a question, which usually you've got in the Ukraine. So they care about you, but they don't care where you did get this hepatitis.
Of course. So does that mean actually that at home, within their family, they didn't know from each other?
No, in many cases, no.
And what about husband and wife?
Yeah, I mean, it's especially if we are talking about hepatitis C. I mean, there is a possibility that you can get also via sex, but in many cases, yeah, they have it and they don't speak about this. So it's
So what happens when they come here and you with them? I mean, do they start talking within the family? Do you help them to kind of start this
I
dialogue,
try.
or?
I try because they are so stigmatized, especially self-stigmatized. It's like you need many talks with them. So first of all, you just need to talk with them and say, okay, you have to go here in the healthcare system. They will help you. They will don't judge you. I will come with you. I will accompany. I will explain you and all of these things. Then you just need to explain. Then okay, look at if you do this and that. So you need to explain your, for example, your parents or your husband or your wife, and this is like it's a step by step, so it's not so easy just immediately to say
Of
okay.
course. But is it successful? I mean, is it successful in the way that you see that they kind of slowly but surely are able to talk better about it, or to see themselves different?
I can say yes. I say yes, especially with the time, and you just need to give the time, especially at the start. They are really scared, and at the start, you don't need to give a big pressure. They will come to you anyway with the questions. And now I see the people who come in March, now they are so integrated. And I know the one family which really now really united because they talk about many things, also about the sex. So, and it's, it's all things come together in the family. So no, we have a success.
That sounds really great. Really, really great. Tell me a little bit about the barriers here in Switzerland for them to get access to the health system. What are the problems?
As a problem that they don't know. they are not aware about this. They come, especially at the start, as I say, scared. They have a fear. They don't say about any health issues. And later, they don't know that they have this right to get very expensive therapy. They always, because in the Ukraine, you need to pay for this therapy. There is no in the Ukraine. You need to pay for them. And here they don't believe, first of all, that the government gives this for free for the refugees. As I know, it's not only for the refugees, it's for everyone here, and you pay your medical insurance. So in this case, the refugee government paid first for your medical insurance. But all of these things, they don't know. They just want to stay like behind all of this and wait until they can come back. Or, for example, people will write me and say, okay, can you tell me where I can buy the medication against hepatitis C? I say, okay, you have a hepatitis C, you know it, okay, but let's go together to the clinic and you will get for free. No way, I cannot believe. So yes, this is possible. But also testing.
Okay, so, but does that mean you say that they're in their home country, they had to pay it for themselves or whatever, it wasn't free or it wasn't as easy as accessible? Does it mean that a lot of times maybe they weren't even tested or they weren't treated because they couldn't afford it? Or do you see that people like from Ukraine are actually have been well treated and had access? I mean, even if they had to pay themselves or not?
Unfortunately, I had really only one case where I can say that this person got medication, not in the Ukraine, but the medication from the India, paid themselves and was cured. All other cases, people, they get tested, they have a hepatitis, and they say, okay, you can live with hepatitis, we just monitor, and or you pay for this treatment, but there is no good access to the medication of hepatitis C in the Ukraine.
Okay, and so what do you think needs to be done here now in Switzerland? I mean, how could we change the system, or how could it be different? I don't know, at the border or wherever when they arrive, that all of them actually learn about all these possibilities. I mean, I'm sure not all of them get to meet you, and so lots of them are not informed, I imagine.
Yeah, exactly. No, it's this is what we started already with Hepatitis Schweiz here to do, and together with AIDS Hilfe Schweiz, we recognize that people come to the migration office and they don't want to talk about this problem, but if they would have like a poster in Russian, Ukrainian, and English languages, usually they just make a photo or you just see that there is a website and later they contact. And we have already several cases via website from Hepatitis Schweiz. They contacted us.
Yeah, that seems like very simple and probably very helpful. Exactly. Our time is unfortunately almost over, I would say. My last question is, how many are there like you? I mean, are you alone out there as a helper, or are there many people doing what you are doing?
I mean, I know several. You know, you're like a network. Sometimes, especially, I work not only for Switzerland. I help people in whole Europe. And sometimes people ask me, "Oh, do you have this medication, or can you help that one?" We just sent to I don't know, to Slovakia, and Germany ask, or you ask Germany. I cannot say how many we are, but there are some people. We are in a networking also in Switzerland, so and. Always in contact. This is important, and especially I mean, it's good that we have a before COVID-19. I would say this is COVID-19 bring us all together as a community, and now we have a refugees and war in the Europe, and we can support people well.
That's really impressive. Thank you so much. I'm amazed, and I think you're doing a very, very important work, job, or help. Thanks for being with us, Alex Schneider, and talk to you hopefully another time.
Thank you very much. Have a nice day.